Mr. McClintock?
Thank you, Mr. Chairman. Two quick questions. We've touched on them, but just true or false. The two principal promises that were made in support of Obamacare were, one, that it would hold costs down. True or false?
I would say false.
Okay.
More so than true.
The other promise that Dr. Price had just touched on was promise if you like your plan, you can keep it. True or false?
Not true in all cases.
Okay. A few years ago, I had a fellow come to me. I was in the state legislature at the time. He'd he'd lost his job. He was in the private insurance market, went around trying to find coverage, was turned down because of a pre-existing condition. He had bursitis. He says, I don't care about the bursitis. That is a nuisance. I'll take care of that. Just write me a policy to cover everything except the bursitis. And the response was, we'd love to write you such a policy, but we can't. It's against the law. Has there been any data on how much access has been denied because of non-life-threatening minor conditions like bursitis, or I believe Ms. Capter mentioned bunions earlier?
Not to my knowledge. The various state insurance departments might well have some feeling for that, but I do not, I'm afraid.
I rather suspect if we restored to people the freedom to obtain insurance policies tailored to their own needs, the lack of access to health insurance would drop substantially. There's an organization that runs a website called coverageforall.org. It's run by a fellow...
Will the gentleman yield for just a brief second? There's a vote on, and my intention is just to keep it rolling. So Mr. Hana is going to be next. So we're going to keep it going just in the interest of time. And I'll stay until near the end when Mr. Rokita will come back and relieve me to go vote, and we'll just keep this going. Thank you.
And it's run by a private foundation. The head of that foundation tells me that they get tens of thousands of inquiries every month and are able to find insurance for these folks either in the private or public sector, about 99% of them anyway. Has there been any study on what is the percentage of uninsured who either can afford private insurance plans and simply haven't availed themselves of it, or qualify for public plans and have not availed themselves of it?
We do have data on that in our model for estimating the health reform proposals. And it's not uncommon to see people who are young, good health status. They have the option of employer coverage and they just don't take it.
Well, the head of this foundation says that they're able to place 99% of the folks that make inquiries. Do you have any data that would support or refute that number?
We could tabulate these numbers from our sample, but I don't know the results off the top of my head. Now, we find many other people, and this is a bit surprising, where they might be eligible for Medicaid or they might be eligible for their employer plan, and they have actually fairly high health care costs, and yet they still don't sign up. Even though it would be in their best interest financially, but something is preventing them from doing it, either lack of understanding or maybe they can't afford their share of the premiums. There's a lot of variation out there in people's insured status.
Final question. You've looked at this issue pretty carefully. What would you say, if you could design the ideal system, what would it look like?
For health care in the U.S. overall? Well, if I had a really good answer for that,
60 seconds or less.
Yeah, if I had a really good answer for that, I probably would be wealthy and doing something else. I'd be happy to talk with you and your staff further about possibilities.
I'll yield back.